welcome everybody. My name's Dr. Rebecca Glasser. I am a plastic surgeon here in town. Janet Gordon-Palm and I have known each other for many years because I'm so appreciative to Janet for the fact that she's taking care of my children. Oswald in particular, who is a huge yellow lab, but both of us really share a passion for medicine. I approach things from human medicine, and I look at traditional medicine and really realize that as much as I believe in traditional medicine, we have a few flaws. And so Janet and I have kind of come together in realizing, what sort of things can we do in order to improve our quality as well as our quantity of life by approaching things through traditional medicine, but also through a holistic approach to medicine. I've already forgotten all of your numbers, but Janet has been in practice for how long now?
Many years. I graduated in 1981 from Kansas State University. I just had a Facebook post where it showed my entrance letter that I was holding up. I was wearing.
I know many of you all in this room have been blessed by Janet taking care of your animals. So tonight, I am really going to turn it over to her, and I am so happy I don't have to speak too much. I can help on the human part of it later, but I am thrilled to introduce Dr. Janet Gordon-Palm, a veterinarian, who's going to talk a little bit about Protandim, NRF2, and Petandim. So right. I'm going to give you the mic, okay, and you can just clip that onto your shirt.
Alrighty, I will do that.
And then I'll run your slideshow.
You'll run it? I want to run it.
Okay, you run it.
I'm a control freak, you guys. I want to be able to run it when I...
Perfect.
Okay. All right. Again, I'm Dr. Janet Gordon-Palm. I've been in practice for many, many years. I think what Rebecca and I were talking about too is, and why all of us are here, is we all are believing that there's flaws in our traditional medicine. We have to have conventional medicine. We don't deny that. We need antibiotics. We need surgeries. However, I think there's been too much reliance in that as a first line of treatment instead of what can we do to cause ourselves to be healthier, to actually lift up our own immune systems and our own natural healing pathways. So we have a bond that we shared as a result of the human medicine and the veterinary medicine kind of going down the wrong track at times. So we're trying to help develop a coalition of people that get it, people that understand this concept. So what really turned me on to this product is the same thing that turned me on to the low-level laser and other ways of activating natural healing pathways. And that is, it's called quantum medicine. We all have heard of quantum physics, and quantum medicine is just what happens at the level of the atom. Those of you who have had me as your doctor for your pets, you poor things, you're just recent. You've heard me talk endlessly about, oh, the electrons get excited, they go up to a higher level, they come back down to ground, da, da, da. So anyway, that being said, I can't help but share some of the science with you guys. Not to bore you, not to overwhelm you, but just to have you see that it's not magic, it's actually science. So that being said, I just want to go through some information for you, some information on the oxidative stress, on where Protandim and Petandim fit in. I'm going to actually throw in some laser because it's the same kind of principle. And you'll see that using modalities together, whether it's good nutrition, hydration, mental enrichment, yoga, all these things help the body heal more efficiently. So these are some tools that I've used, and Protandim has been a huge part of all of that. So this is a few of my whys. There's a picture of me and my horse, one of my cats, my husband, my cat, and all of us are NRF2 activated, and we all have access to some of this information that you'll be sharing today. Good nutrition, hydration, how important it is to have decreased stress. We talk about that with your cat Dash. You guys have done a wonderful job of giving him his enrichment. And then I love this. Rebecca, you can't see these things. This is a meme. It says, you will need to lick the affected area as often as you possibly can. It's Dr. Dog. And again, I had a dog that had a wound, and I just let him take care of it. When we have animals that lick, as long as it's not to an excess where it actually causes more aggravation of the wound, licking can be a normal form of myofascial release. You know, they're actually helping to increase circulation, lymphatic drainage. So some of that can be okay. We just have to curtail it in different ways, but I just thought that was a great meme. And then two, here's that one we always see on Facebook or other places. Each client or each patient carries his own doctor inside of them. They come to us not knowing the truth. We are at our best when we give the doctor inside of us a chance to thrive, you know? So again, all of our body is geared towards survival, and it's geared towards treating ourselves. Here's a map that you have seen of oxidative stress and what it does to the body. And I've had people all the time when I prescribe Protandim or Petandim, how can one pill do all of these things to all these different conditions? You guys have heard the same thing when you've been talking to patients and family and friends. And when you realize that all of these conditions are the result of oxidative stress, which is damage to our cells. And that damage to our cells occurs because of a lot of the toxins our body gets overwhelmed with. Our body can't keep up with all the free radicals, which are the toxic effects of overexertion of our body, toxins that we inhale, toxins that we eat, those kinds of things. If our body can't keep up with that, then we end up with oxidative stress. That causes chronic inflammation. That's what ages us. And guess what? Whoops, backwards. Animals get that too. So I've got a little map here, Rebecca, of the little dog and all his little stressful issues. And again, one pill can help all of these things. It can help arthritis. It can help seizures. It can help inflammatory conditions. It can help all these things because what is the basic ingredient of all of those conditions? Oxidative stress due to toxins being built up. The body can't keep up with cleaning house, so to speak. And if you've not heard of this word before, I know you have, mitochondria. Mitochondria is the battery inside of all of our cells. And those batteries get depleted and they get damaged. And so repairing the mitochondria will help decrease the chance of oxidative stress. So a lot of what you're going to hear with the products that we're going to be talking about helps to repair the mitochondria and also decrease oxidative stress, decreasing inflammation, all these things. So that's why one pill can help to minimize symptoms. It doesn't cure. We can't say it cures, but we know that it minimizes. I can't say my laser cures, but when you see the responses of improvement in symptoms, sometimes conditions can resolve when the body takes over and heals itself. So we're just trying to get obstacles out of the way. Side effects, damage, those types of things. Here, oxidative stress, the definition of that. It's an imbalance between the accumulation of systemic reactive oxygen species. That's just another name for free radical. And then the body's ability to detoxify and repair damage is overwhelmed by the accumulation of all of that end product, all of that trash, so to speak. And so oxidative stress can also interfere with our body's ability to signal tissue cells. I promise this is the most wordy slide in the whole thing. But again, it gives definitions. And so forgive me for being in your way here, but yeah, I was just going to read it off for you. Increase of oxidative stress or the reactive oxygen species in the presence of damaged mitochondria, like we talked about, can actually decrease the amount of ATP being produced because ATP is the fuel that fuels our body. And the cells will cause, the mitochondria in the cells will cause ATP production when everything's functioning perfectly. When it's not, we have a decrease in ATP, which is a decrease in fuel for the cell. So that's why it behooves us to make the body as functionally able as possible. Oxidative stress further damages mitochondria, so that results in an energy crisis. So if we don't have enough fuel for our cells, we've got cells that aren't able to regenerate very effectively. Wounds aren't healing very effectively. We've got, tissue that's being attacked by medications we're on constantly. And I've been giving, discussions on even what the laser will do to repair the mitochondria, along with the NRF1, which is the mitochondrial support product That includes, you've probably heard of this before, quercetin, resveratrol. Resveratrol is in red wine and grapes, and quercetin's and all those are plant nutrient. Those are things that act as building blocks. And simply what my laser does is help to speed up that process. So I like the two of those together. I've got a meme here. You might want to see this one. You might even want to borrow this one. What gives people power? Money? Status? Mitochondria. That's what gives people power. And it's true, because if our mitochondria are all ill, then we're in really bad health. We're in bad health. And health is wealth.
That's right.
NRF2, the nuclear factor erythroid 2 related factor. Did anybody know how to say that when you say NRF2?
Yeah.
It's a process. You have to train yourself. When people say, well, what does that stand for? Just impress them with that. That's probably the last time you'll ever have to say that. But NRF2, it's just so easy to just say that acronym, because that's what even the scientists use when you look at some of the published papers. This is really cool, and this is what Rebecca had alerted me to. There is a quote by Martin Paul, PhD, and Stephen Levione, PhD, Washington State University, and they say, we may be on the verge of a new literature on the health benefits of NRF2, which may well become the most extraordinary preventative breakthrough in the history of medicine. That's conventional medicine talking, that this study of activating natural healing pathways might be able to stand, or, but we won't be able to see the slide, so.
It's okay.
Okay.
Yeah, I'll get
Okay. Okay. So sorry about that, everybody. So anyway, this is so cool because they're admitting that this could be the huge breakthrough in preventative medicine. Now let's just get Big Pharma to, just relax a little bit and get out of the way so that we can express this. We can all live together. That's the irony of it. Why can't Big Pharma see that if they help promote health and well-being in people, they'll still be selling their products. We still will need certain pharmaceuticals.
True.
So here again, the NRF2 is the master regulator. You've probably heard Rebecca say this, and Therese say this, and Rhonda say this, and all these people are saying it's the master regulator. And what does that mean? It regulates the endogenous antioxidant response pathway. So antioxidants, of course, are what help. It's like eating blueberries. That's a good antioxidant. We all know that that helps to break down some of the free radicals. So the master regulator means NRF2 helps to direct the body to make these flood of enzymes. And this flood of enzymes are what help break down those free radicals. Now, interestingly enough, babies are born with a well-developed NRF2 pathway. So their babies are growing and developing so fast that their body's toxins and the byproducts of those cells are actually building up so much that they need all those enzymes to help get that out of the body's system. So babies have a well-developed NRF2 pathway. As we grow and develop and we've aged, matured, survivalists tell us, we just need to gradually get out of the way for the next generation. But we're saying, oh, hells no. We want to make sure we are around for a while. So we have some ways of hacking the system, biohacking the system, where we can actually cause our body to rejuvenate a little bit and have that NRF2 pathway accelerated again. And so they found that certain plant nutrients, not drugs, certain plant nutrients will do that. And you've heard before, and we'll go into a slide here shortly with what Protandim includes. But that's going to be over and over again. You'll see those same kinds of plant nutrients discussed over and over again. So it activates 24 genes that actually help with detoxifying the body. And then that flood of enzymes come in and clean house. These functions result in lowering the mechanisms that are involved in dozens of chronic inflammatory diseases in humans and animals. And that encourages activation of the NRF2 pathway as an adjunct to healing. And we can affect the common denominator of most, if not all, of these chronic degenerative diseases. Sounds like magic, but as Isaac Asimov has said, everybody knows that writer, science fiction writer, magic is science not yet explained. Well, we've got the science, we're starting to explain it now. Yeah, but Okay, so they don't have to memorize these studies, but I included them. Rebecca kind of rolled her eyes because she knows, we're just trying to be basic here. The only purpose of putting these studies in, now this is a talk I gave at AHVMA, the Holistic Vet Medical Association, and I had a lot more veterinary speak in it. I want to prove to people that this is not just a supplement that has a brand name on it that somebody sponsored people to go in and talk about. I wanted to show that this is science that's being studied outside the realm of LifeVantage. Transcription factor NRF2 as a potential therapeutic target for prevention of cytokine storm in COVID-19 patients. Oh my gosh, it helps prevent that acute respiratory distress syndrome, that flood of fluid that goes into your lungs. I've used it for animals that are in that place. And when I was doing my research on this for my talk, in animal ICUs, 100% of cats die of acute respiratory distress. When they're in smoke inhalation situations, when they're in electric shock where their body gets flooded with the cytokines, which are those inflammatory cells that go, oh no, we've got to protect the body. Let's flood it and help to cause it to, minimize the inflammation. Well, that flood literally drowns them. So this decreases that body's overreaction and doesn't flood the body. And so that's what this can help do, and so can my laser too. You'll see that in a second. So this is just the conclusion, telling about how NRF2 has been helpful for COVID. I'm so happy I met Dr. Glasser in 2018 because I was well on my way with LifeVantage and all my products for NRF1, NRF2, NAD, all this stuff. And COVID, I had a lot of protection. Let's just put it that way. So my immune system was happy. NRF2, a dark horse in Alzheimer's disease treatment. What? Alzheimer's? Oh my gosh. Inflammatory disease. Oxidative stress. Again, all these different diseases, when we actually can help to create a flood of enzymes that will decrease the body's overreaction to inflammation, then we help minimize symptoms in so many different diseases. Role of NRF2 and its activators in respiratory diseases. We talked about that. We talked about essential NRF2 in diabetic wound healing. I mean, again, that's just another example of an inflammatory process with oxidative stress. Phytonutrient sources of NRF2. It's not just Protandim. Protandim is the brilliance of Dr. McCall. Was that his name? McCord. Sorry, oops. Sorry, Dr. McCord. Anyway, the brilliance of somebody putting these together and finding a synergy of these doses of these 5 ingredients, which you'll see in the next slide probably, that actually helps to decrease inflammation and decrease oxidative stress by 40% in that first month, and 70% when they're on longer than that. And so the ingredients they're saying here is curcumin, which is turmeric. You've seen resveratrol before, that's in the NRF1. That's in berries, nuts, and red wine. There's different combinations like milk thistle, which is good for the liver. That's in NRF2. So, I mean, we've got all these ingredients that have been studied and used thousands of years for some of the same issues. They just didn't have a name for it. But we know now that there's a lot of wealth in knowledge. So Protandim, you've seen this slide before, shows again the different ingredients, the turmeric, the milk thistle, the green tea extract, ashwagandha, and bacoba. And so all of these different nutrients are put together and causing that benefit that we know as decreasing oxidative stress. Petandim, what a brilliant idea. If it works with humans, just about anything with a mitochondria is going to have a similar response. LifeVantage can't say you can use this in cats, you can use this in horses, you can use this in dogs, because in order to say that you have to do tons of studies, clinical studies, get FDA approved and all that kind of stuff. But you can also connect the dots. Is it going to cause harm? No, it's not going to cause harm. So we can, as a doctor, as a veterinarian, I can extrapolate from the science, from knowing that it's not going to cause harm if used correctly, with realistic expectations. It's not a magic wand, just like my laser is not a magic wand, but we can actually minimize oxidative stress in all of these dogs' issues, arthritis, mental issues, neurodegenerative changes, anything that has inflammation. Allergies? I know. But it needs more than just this, as we know. It's not a magic wand. Yes?
Anxiety?
Anxiety, absolutely. And they found in humans, and you could probably speak on that too, in humans, people with PTSD, people that have, and even autism. Autism is a disease of oxidative stress. When you help to minimize that oxidative stress, which anxiety causes too, I mean, we can minimize, and again, it won't cure, but it's one of the building blocks that can help us resolve that. Now I'm going to talk a little bit about my laser. Not much. Don't worry, Rebecca. We're going to get back to it. But it's a 1-2 punch, and that was the name of it. Get a kick out of. Here's a bottle of Petandim sitting conveniently on the checkout stand at Redstone Veterinary Hospital, where I've met you, Carol.
Yeah.
And next to it, you can't read this, but I write out, and you guys will love this, and I'll laugh at this. I write out a prescription for that animal to have 30 minutes outside in the sunshine, paw to earth grounding 3 times a day.
What?
Yeah, I write it on a prescription. And so I have that written right here. So that, and even if they're in for ICU, and then we have to take them over to the emergency clinic for a follow-up, if it's feasible for that animal, I tell the owner, take them home first, let them sit on the ground, let them be out in the fresh air, if it's not winter, you know, within reason, and just give them some nature, vitamin nature. I think that's so important. That's something we forget. They get electrons from the ground. So that paw to earth grounding, we will too. So if you take your shoes and socks off for 30 minutes and put your feet on either cement or ground, not asphalt, but cement or ground, it's anti-inflammatory. You will, sorry, I'm giving you the. My husband said it's my best side, but I disagree. Sorry, this is not supposed to be this rated. So anyway, yeah, you can edit that. Yeah. So anyway, paw to earth grounding, there's so much to be said for that. So anyway, this dog had completely torn the right ACL, was 104 pounds, and we started the dog on Petandim immediately, and it's a large 104-pound dog, so cost-wise, they ended up going with some Protandim too after a while, but really 3 Petandims is what we started him out with. And so I did some laser treatment on him. Now, the dog's now weighing 84 pounds, and you can barely tell which leg the dog is lame on. And this was doing 2 laser treatments a week for 4 weeks, and then we did a laser treatment a week for 8 weeks, and Petandim the whole time through. And the dog went from 104 pounds to 84 pounds gradually, not dramatically overnight. And the dog was on monthly laser for maintenance, and again, lived on Protandim. This is another dog. I cut out some of the real graphic pictures for you guys, because again, this was for veterinarians. This is a dog, a big mastiff, that had a huge spider bite on its front leg that was about 4 inches by about 6 inches and all the way down to the bone when I met this dog. And it had been 6 months duration, and it was resistant to all antibiotics. And the bandage had maggots in it. It was gross. And so, yeah. So we had to soak all that off and everything. So I saved you guys that part. You're welcome. Yeah. And then here's me lasering the dog from the top. Again, we've got the dog on. This dog ended up being on Petandim no, actually it was Protandim, sorry. Such a big dog. We gave half of a human Protandim once a day. This is one that, if you guys have people who want to get their product on Amazon, this is the dog I always use as an example. The dog boarded with us for a while. The owner gave us her Protandim, but she ran out. So I used some of my own. When she came to pick the dog up, I gave her the few that I had left because she still didn't have her order yet. And she says, that doesn't look like what I was using. She had gotten her Protandim from Amazon, and she was using a completely different product, same bottle. And so I reminded her that on the news, Gail King was interviewing somebody from Amazon where they used ProViable, which is a dog probiotic, as an example, because that was a complete fake. They had fake product inside of original packaging. So you have to really be careful and tell your clients it's an expensive modality to use the wrong thing, you know? And of course they're not gonna respond. And it just breaks your heart. So this dog was an example of, she surprised me. She got it cheaper on Amazon. It's like, I called Rebecca, she goes, oh, that's fake. But then she found out when she saw the different color in the tablets. But then there's the way the laser looks, just going back and forth over that wound. And that's when it was half healed. It was huge before that. So then, here it's closing up, again, expedited, not only by the laser, but by decreasing oxidative stress with the nerve too. And then, you guys will love this. This is where mixing work and play is helpful. This was a Harry Potter fan that owned the dog. I have a Harry Potter wand that has a little light on it. So I did a little incantation at the end there. I'll play it and then I'll say it because you guys might not be able to hear it. I made my own incantation. It was Spider Biticus, heal foreverum. And the owner just loved it, but it was healed. So it was a great outcome, completely healed. And that was in, let's see, what was the timing? It was 6 weeks healed, where it was 6 months, a big ulcerative mass. So yeah, failure is not an option. They gave me this cup. They were so happy. And that's the part that's so exciting. That's why you guys, you've got ticket to this too. Helping people get their animals and themselves and their family members health and well-being that they haven't had access to before. It's addicting. I mean, it is. This is a dog that actually got into xylitol. Does anybody know how bad xylitol is for dogs? It's a sugar, it's a non-sugar sweetener. Artificial sweetener. It's XYLITOL. Yeah, xylitol. And this dog got into 78 pieces, where 3 pieces should have killed him. 78 pieces 3 days before I saw him. The owners came walking in with him draped over their shoulder. It was horrible. And 3 days before, I couldn't induce vomiting because the dog was already that far gone. Did blood work, liver was shot. That's what this does, is it completely causes liver failure and blood sugar plummets. So I thought, I gave them a poor prognosis, but they wanted to try. And they only had a certain amount of money. They couldn't go to the emergency clinic at all. They wanted me to do what I could that day and then see what happened. And so I called internal medicine specialists, say, what part of realistic expectation am I missing? Because I'm feeling that I'm causing them to spend money that may not be well spent, And they said, well, 65% will die no matter what you do when you just find them and induce vomiting, let alone what happens. So I gave them that information. They still wanted to try. So we did the IV fluids, we did the anti-nausea medication, started him on Protandim after I gave him some anti-nausea medication, and I did 2 laser treatments. He was no worse that day. We unplugged him, sent him home. He was supposed to come back in the next day, plugged him back in. They said he actually seemed a little bit better, didn't have any vomiting. Okay, so plugged him back in, continued supportive care. That was, the first day was Friday, the next day was Saturday, sent him home Saturday. Couldn't go to the emergency clinic, cost too much. Came back, I said, please come back Monday. Monday they called up. They said, he's doing so well, they wondered if they could wait till Wednesday to come in. Sure, he's on Protandim, my laser in a bottle. And so that's what I call it. And so he came in Wednesday. We did a very, very short test on him that was only $30 to test 2 liver enzymes, and they're still off the scale. But he acted like he didn't know, he didn't care, so we didn't tell him. So anyway, that's my thing. You treat the animal, not the lab work sometimes. So 6 weeks goes by, I'm calling, I'm checking in on him. Sometimes I get a hold of him, they say, yes, he's doing okay. Can you come in? Well, we can't afford to yet. Okay, well, whenever you can. 6 weeks later, my colleague saw him. His plan turned over now. He had blood work available. He had an ear infection. So she treated the ear infection, did just those 2 enzymes again, and liver enzymes were normal. So again, why, I can't say the Protandim did that, but I know that it helped based on oxidative stress. I can't say the laser did all that. But we're changing the baseline for these chronic conditions. We are actually causing the body to say, hey, it's not my time yet. You know, it's almost like if anybody rides horses, there's a half halt where you're riding along and then you do a little half halt to help cause them to regroup. It's like the body's going along, mitochondria getting worse and worse and worse, and finally it goes, wait a minute, let's plateau for a little bit. And that's what we're allowing to have happen by stimulating some of the natural healing pathways. So again, this is just what I've already spoken about with lab work results for that dog, and just the outcome.
Does your dosing on any of that make a difference? How do you figure, dosing wise?
The dosing of yeah. Oh, again, we go by the, so.
Hey, Bojangles.
There's Bojangles is his name.
You had to go home? Say hi to Sierra.
Sierra was one of the techs that took care of him, so I said, say hi to Sierra, he's going home. And then this was him coming back. See, I told you, Rebecca, I'd go through this fast. And here's a cat now. I know we're not spending a whole lot of time on cats. It's off-label with cats, but it is an animal with a mitochondria, and they respond the same way. Dosing-wise, it's kind of tricky, but it's a nutraceutical, so we're not going to get in trouble overdosing, but cats don't like the taste of it. So, we've all probably talked about, or you've heard about, if you're using a human tablet, I break it in half, I put it in a Ziploc bag, I crush it up, have an owner take their finger. It's not rocket science as far as the exact dosing, but a little bit of it can help. So oftentimes with cats, we'll just, give a small amount and just gradually work up. On the Petandim, which is more scored and more precise, is like a quarter to an eighth of a tablet of the Petandim for a cat once a day. Otherwise, with the human one, it's pretty concentrated, so just a tiny bit. And I usually put it in butter or coconut oil or bone broth or high-value treat. Never their food, because the food can taste a little different, and cats are so picky. We don't want them to ever not eat their own food. So I always make sure it's a high-value treat. But this is a cat that had a history of urinary tract issues for 2 years before I met the cat. And we know that a laser is not going to cure that by itself. We know that Protandim is not going to cure that by itself, but the two together, that 1-2 punch for oxidative stress. What is urinary tract disease? It's oxidative stress. It's a bunch of stress and inflammation that's building up. In this cat's case, it was management issues as well. This cat was stressed out. It was an indoor-outdoor cat that was being tried to be kept indoors. The indoor cat that was already there was beating him up. And so management had to occur, water consumption, want to make sure the cat had plenty of water. And then we added those 1-2 punches, oxidative stress release. And this cat has not had an issue. Let's see, I had 2 flare-ups in a year's time. And then I just saw him this morning because he injured his paw. So I had to show you, that's him this morning. I thought, well, I'm going to make it very current. So his name is Poe. He has no feline lower urinary tract disease symptoms or flare-ups for over a year, but he sprained a muscle in his shoulder area on an outdoor adventure. And when I went there this morning, I said, because he's in my presentation, I thought it was odd that all of a sudden he's now injured his leg. I said, I have to find out for the group I'm talking to, has he had any other flare-ups? I know she would have called me if he had, but money's tight these days, so I just didn't know. And I have a sliding scale sometimes, sometimes if they are really trying to make ends meet. So Kenzie Ann, this is a Redstone client too. This is a Schnauzer that came in. Kenzie Ann is a Schnauzer that had pancreatitis, inflammatory bowel disease, and she'd had it for 3 or 4 years where she couldn't really get her to eat well, and she would have bloating, and she would have diarrhea, and she would have vomiting issues, or she just wouldn't eat. But we started her on Protandim only because this dog's allergic to chicken. And because there's chicken collagen, and that's the other thing to be careful with your Petandim, dogs with allergies may not be able to take that because of the chicken in it. So anyway, she's on it like, and again, there's no specific set dose for the human one. It's all off-label on that. But for this dog, I think she gives her about an 1/8 to a 1/4 of a tablet of the human Petandim. She actually shares it with her dog. So you'll find that happening a lot too. So the dog is now weaned off of Serenia, metronidazole, and she asks for her food every day. And this has been 3 years I've been treating her. She comes in every 3 weeks for her laser tune-up, and she's been on the product Protandim, and so is the mom on Protandim now. So, I mean, you get all these animals that are feeling better. And I thought this was cute because this is her getting her laser, but there's a little video of her, and I was lasering her with the line generated beams. I can just look down and laser. I stepped to the side, and without looking up, she did this. And then I thought, that's only going to happen once. And I continued. I said to the technician, let's see if she does it again. And she did that. So it's like, they feel it, they know that something's happening. Just like, you know, people say with the Protandim and stuff, how do you know? We know when it's almost done. We know when our brain fog goes away and when we have better sleep, but the animals can't tell you that. So eventually you'll see. And this just talks about oxidative stress with pancreatitis. There's a dog with post-op, had a TPLO, which is for knee surgery, and we ended up using, she's still on Protandim and Petandim. She's using, usually it's Petandim, but then when she gets low, she shares her own. So this dog's been on it for 2 years, and that's her just loving being treated. Here's a horse. If anybody's into horses, you've got clients that have horses. This is a horse with laminitis. 6 months duration of really severe lameness on this horse. Dr. Braden Schaefer, good friend of mine, he believes in what I do. He believes in the Protandim. Still haven't gotten him to, you know, us veterinarians, it's hard for us. We just want to prescribe things, but we don't want to really get in the business part of it. And I think he's almost there. But anyway, he suggested I look at this horse. And so I did my combination of Protandim and laser. And within 2 weeks, that's just 2 weeks. Now the horse still has laminitis. We didn't cure laminitis, but we decreased the inflammation. We decreased the oxidative stress. We caused this horse to be more comfortable. Braden was going, oh my gosh, you know, I just keep wondering, how much is it going to take, Dr. Schaefer, before you start to want to do this yourself? Some vets are more into the conventional because it's comfortable. So I give them a lot of room. So Vinny was a 27-year-old quarter horse gelding. This horse, you can see how crooked. So you can't just do one thing by itself, but I have long distance recommended horses start on Protandim well before I come out to see them. They might want to save up money to have me come out. In the meantime, start them on Protandim. So this horse is on Protandim. We had to straighten him out, and then he's been on Protandim to help him with his laminitis as well. And he's still going strong he's 28 or 29 now, and she still rides him. Nice. My own horse is Nerf2 activated, and he is like a poster child for what I do because he's 26. He just turned 26, and he neighs around. I don't know if you saw anything on Facebook, but he just neighs around and gallops around and bucks and farts and has a good time. And I get that out of him before I get on him. So the conclusions are, Nerf2 activation offers antioxidant benefits through signaling transcription factors to express enzymes such as superoxide dismutase and catalase, among others, that break down free radicals. You don't have to memorize those enzymes, but for the veterinary group I did. Photobiomodulation, which is laser, does improve the patient outcomes through increasing the circulation, increased lymphatic drainage, and decrease in pain and inflammation from the same similar underlying quantum medicine that we're seeing with the Nerf2. So the combination of these two modalities as an adjunct to other forms of activation of the patient in healing will just help the healing improve dramatically. So one of my favorite reminders is no one ever injured their eyesight by looking looking at the bright side of things.
Very good.
So I was so happy I was on the Protandim because of my oxidative stress levels being low. So my body was already primed, my immune system was already improved to help handle an onslaught of virus that we didn't know anything about. And this, look at the common colds, look at all these different things. I don't get sick much generally, but I've not had flu or cold for a long time. A lot of that has to do with trying to take care of yourself. Protandim being one of them. So the same with pets. You look at what they're exposed to all the time with the things we can control and the things we can't control. We can't control, if we're in an urban situation, the toxic fumes coming out of vehicles. We can't control the glyphosate that's in our groundwater. That's the Roundup, pesticides. We can't control the EMFs, which are the radiation that comes from cell phone towers and all this stuff. Those all cause oxidative stress. What we can do is help cause them to be more resilient to stressors. And so by putting them on something that's going to help decrease that oxidative stress, we can cause them to be able to handle the occasional overexertion of their body. They use this a lot for athletes, as you could probably talk about in their recovery. So the same thing with our animals, they're athletes. A lot of horse trainers are using this for race horses, for dressage horses, to help prevent them from having the breakdowns. You look at all the breakdowns on the racetrack, and there's so many other things that are going on with that, the age of these poor horses when they're starting them. But I happen to think if all these horses were on Protandim, I think we'd be seeing a little bit more resilience in some of these horses that are put through a lot of stress. Take away the other things that they're doing, but I mean just performance horses in general. So for preventative medicine, it's definitely.
I'm going to talk about a little bit more on the human side of that. So Tandem and Protandim both are acting by the same mechanism, which is activation of the NRF2 pathway. Each of these products is named often after the pathway that it activates. So much of Janet's talk was really talking about oxidative stress. So if we're really going to simplify this into layman's terms, I think of oxidative stress as free radical damage, or what we think of as our bodies rusting as we age, okay? So oxidative stress, if you look at a teenager, like my son, who's growing exponentially and as healthy as can be, as you continue to age 20 to 40 to 60 to 80, if you're looking at that from a timeline standpoint, that oxidative stress continues to increase as we age, as does our free radical damage. Okay, same words. And our body's ability to get rid of that oxidative stress or that free radical damage decreases because we no longer produce those enzymes, which gets rid of it. So in both of our practices, we're really looking at things from a preventative standpoint. For me, so once my dog was six months old, I started him on Petandim because he's a lab, he's an 85-pound dog. I want him to live 15, 20. I mean, he's a big dog. I want him to live a long time. But I also know that the longer I keep him on that preventative Petandim, the healthier his life, the more active he will be, the less likely he is to get to disease or have problems with arthritis or inflammation. Well, guess what? We humans, we're the same way. We want to live long enough to enjoy our animals, and we want to live a long time ourselves with a healthy life. So to me, so much of what we do, you heard a lot about the acute, how we're treating these different diseases, but what I want you guys in the room to really think about is a preventative standpoint of it. So both humans and dogs, cats, horses, should be on these products from a preventative standpoint, okay? Now, the other thing I really want to point out, which I think too is really paramount in Janet's talk, was talking about inflammation. So think about inflammation for a minute. So anything with the word itis in it is inflammation in medical terms. Arthritis, colitis, anything with an itis, appendicitis, everything that's got an itis in it is inflammation. But when you really think about inflammation, heart disease, diabetes, Alzheimer's, dementia, okay, she talked about all of those different things. And so think about what Protandim is doing. it's causing an upregulation of anti-inflammatory enzymes. It's lowering inflammation in the body. So when a horse has laminitis and is unable to walk because of so much inflammation, well, as soon as you reduce that, then the horse is able to walk again and repair and heal. Same thing in humans. You know, you got a lot of inflammation going on, whether it's autoimmune disease, whether it's heart disease, diabetes, Alzheimer's, all of these different things. We can never make the statement that any of our products, which are vitamins, cure, mitigate, or treat disease. But we all know very well that they affect it greatly. Okay? So keep your eye on prevention, because to me, that's how you want to live a longer life, but more importantly, a healthier, longer life.
And the reason for the acute conversation is to say